What's going on, ladies and gentlemen? It's your boy Brad back with another video, and per request, what I wanted to talk about in this one is dealing with death in nursing and how do you handle it whenever a patient dies.
Are you listening? Nurse Pass. Beast mode. Grinding. Yeah.
Most of you have probably heard of the term pulling the plug. Did you know that the official medical terminology for pulling the plug is terminally weaning? You know, whenever you have patients who are on the ventilator, you wean them off of the ventilator as you prepare them for extubation. Pulling the plug is called terminally weaning. Saw that the other day. And so whenever you have patients who pass on you, how do you handle it? How do you deal with it? You know, this is one of the topics, one of the kind of touchy topics that isn't really talked about that much in nursing school. Because it's hard to talk about it, for one. It's a difficult topic, but also, how do you tell somebody, you know, you need to react like this whenever you're in this certain situation and whatever. What is most important about this to understand is that each and every one of you are unique, and the way that you're going to handle these kinds of things are unique to you also. You have your own perception of death. It's important to understand that. It's important to have your own perception of death, how you perceive things, and also how you deal with these kinds of stressful things. A very important thing, in my opinion, is decompression. And what I mean by that is talking about it. You need to let off some of that steam, if you will. You need to let some of that air out. And a great way to do that is to find somebody, a coworker, possibly, who has been through this kind of thing before, has seen patients pass, and, you know, just have somebody else to talk to. It would be a little bit more difficult if you wanted to go home and try to talk to your spouse who has no healthcare experience or anything like that. You know, that's not suitable. You probably wouldn't even want to talk with them about it. But decompression is very important. Number two is make time for yourself. In healthcare, I was reading recently, there's this thing called compassion fatigue, where nurses and healthcare workers alike pour so much of themselves into their patients that they get burnt out. And one of the primary ways that it is recommended to remedy this issue is to take care of yourself. You know, we've said it before, you can't take care of patients if you don't first take care of yourself, and it's very true. And if you're working in areas like the ER or ICUs or even labor and delivery, you know, every day's a birthday, but, you know, some of those births aren't successful. And so you see these things day in and day out. It is easy for a caring nurse like yourself, who pours yourself into your patients, to become fatigued and burnt out whenever patients pass. So it's very important for you to take care of yourself also. Make time for yourself, do things that you like to do, to not take work home. These are generalized, kind of vague tips because, again, probably one of the main reasons it's not really talked about in nursing school is it's hard to, you know, give somebody advice about this. But those are good takeaways. Decompression, talking about these things with another coworker or somebody else who has been there before, and certainly making time for yourselves. Those are two great takeaways. And that's how you deal with it. And that's how you wake up the next day and put on your scrubs and go back in and do it again. I hope you enjoyed the video. If you're new to the channel, be sure to hit that subscribe button down below. I'm putting out content every week to motivate, uplift, and inspire you to be the best damn nurse you can be. It's your boy Nurse Bass, and I'll catch you in the next video.